Thank you for taking part in National Clean Air Day. This webinar is aimed at health professionals to help you fulfill your crucial role in helping patients to protect themselves against air pollution and reduce air pollution more broadly. The information in this presentation is intended to help you as health professionals to use your role as a trusted advisor, to have conversations with your patients to help them understand the impact of air pollution on their health and what they can do about it to protect themselves. And this is to be used in conjunction with a National Clean Air Day leaflet. Secondly, to spread the word among your colleagues. Please take this presentation to your team meetings, briefings, and other events to let them know about air pollution and health, so they can have similar conversations with their patients. And thirdly, be a local leader. By taking action at work and as an organisation to reduce your contribution to air pollution, you can inspire and influence others within your local community. As health advocates, there are also opportunities to work with local partners to help drive and coordinate joint action on air pollution to benefit public health. For example, by working with your Health and Wellbeing Board. The slides in this presentation cover a wide range of health impacts and actions. You can choose those that are most relevant to your health specialism and patients. Air pollution is a major environmental risk to health in many of the UK's cities. It increases our risk of a range of health conditions, from stroke and asthma attacks to cancer and heart disease, with children being particularly vulnerable. It also puts a significant burden on our health services and society. The costs to society of air pollution are on par with those from smoking and obesity. However, air pollution should not and does not need to be a fact of life, and there is plenty we can do to reduce pollution levels in our cities and protect our health. Air pollution in the UK is not a new problem and is one that we have dealt with over the decades. Soot and sulfur dioxide from coal burning and lead from petrol engines are now less of a problem. Today's air pollution is mainly nitrogen dioxide and tiny particulates from vehicle exhausts, especially diesel and industry. This problem has been exacerbated by the increase in new diesel cars, the tenfold increase in vehicle distance travelled over the last 60 years, and the concurrent 30% decrease in walking between 1995 and 2003. This decrease in walking will also be contributing to the health burden of physical inactivity. The proportion of different pollutants in the air depends on the weather, location, and time of day. You are most likely to be affected by air pollution in the morning, when a combination of still conditions and the morning rush hour means that traffic pollution is often at its worst. There's often a second, but smaller and broader peak in the late afternoon and evening. There are also differences depending on days of the week, with traffic pollution generally being lower on Saturdays and Sundays compared to weekdays. Breathing in air pollution doesn't just affect your lungs. It contributes to a range of health conditions, which can be most profound in those most vulnerable, such as children, unborn babies, and respiratory and cardiac patients. Some of these health impacts are listed in the following slides. Being exposed to air pollution for a long time, and by long time we mean persistent exposure to significant levels of pollution over a number of years, is linked to a number of cardiovascular diseases in adults, such as atherosclerosis. Air pollution increases the risk of death from cardiac and respiratory causes, especially among people with pre-existing cardiac or respiratory conditions. Air pollution increases the risk of getting lung cancer and contributes to about 1 in 13 cases. Prolonged exposure to severe air pollution in patients with pre-existing conditions can contribute to the exacerbation of bronchiectasis, chronic bronchitis, emphysema, and asthma. Preliminary evidence further suggests that air pollution may increase the risk of type 2 diabetes, and that people who live near busy roads are more likely to get dementia. But further research is required in both areas. Exposure to air pollution has a more pronounced impact on children's health. Exposure to air pollution, both during pregnancy and after birth, has an adverse effect on lung function development. There is a strong link between air pollution and the development of asthma, and it is possible that it also plays a part in causing asthma in some individuals. Amongst children with asthma, Those exposed to higher levels of air pollution suffer more frequent chronic respiratory symptoms, with increased asthma attacks, increased hospital admissions, and increased daily mortality. High air pollution is linked to low birth weight and premature birth. Exposure to air pollution is also linked to increases in coughs and bronchitis and can increase the risk of bacterial pneumonia. Research is also beginning to point towards effects of air pollution on the developing brain, but more research is needed. While the impact air pollution can have on your health is profound, there is lots that everyone can do to reduce and avoid air pollution. As health professionals are often seen as trusted messengers, NHS staff have a great opportunity to lead by example and inform patients and visitors. Let your patients know about the health impacts of air pollution, but make sure you also let them know what they can do to minimise their exposure to polluted air. The following actions have all been reviewed by professional health bodies, including Public Health England and the lead authors of the Every Breath We Take report, Professor Stephen Holgate and Professor Jonathan Grigg, and they are recognised as being effective ways to reduce and avoid air pollution to help people protect their health. Patients can take action to reduce their exposure to air pollution and help avoid adverse health impact. Talk through the following actions with them and see which ones they can do. Number 1, discover the side streets. Using quieter streets when you're on a bike or on foot can lower your exposure to air pollution by 20%. Number 2, get out of your car. Car drivers can be exposed to twice as much air pollution as pedestrians and 9 times more than a cyclist. To avoid sitting in your car in heavy traffic where pollution can build up, and walk or cycle instead. Number 3, get active. Leave your car at home and walk to work. You'll create less pollution, breathe less polluted air, and get all the health benefits from exercise. But avoid strenuous activity when pollution is high. There are about 10 to 20 high pollution days a year, when it's better to avoid strenuous exercise if you have a heart or lung condition. You can check the pollution in your area for free at uk-air.defra.gov.uk. But on balance, for most people, most of the time, it is healthier to exercise than sit it out. To illustrate the benefits of discovering side streets, this walking map shows how pollution levels vary significantly from street to street, and how with this type of information, people can plot less polluted walking and cycling routes. Based on this type of knowledge, a local authority public health team amended the exercise advice in their chronic obstructive pulmonary disease patient pathway to encourage vulnerable patients to walk on quieter, less polluted routes. Looking further at pollution levels inside and out of a car, this graph shows the pollution a city worker was exposed to during their normal day. As can be seen, there was a major peak in pollution exposure levels when the person got inside a car during the taxi journey, in stark comparison to when the person was walking around the streets or on the train. The message is, walk or cycle when you can. Further actions to help people avoid harmful air pollution include shutting out pollution. Blocking out air pollution helps, so close the windows during rush hour if you live or work on a busy street, but always make sure that your room is well ventilated. Take a walk on the inside. Walk on the inside of the pavement rather than close to the curb to stay as far away as possible from exhaust fumes. Turn on and keep out. If you're stuck in traffic, close the car windows and turn on the air conditioning so you're not breathing in pollution from the cars around you. But use your aircon sparingly. It increases the buildup of carbon dioxide, which can make the driver feel drowsy. Travel at quieter times. Avoid travelling at rush hour when traffic jams mean pollution is at its highest. Giving patients the knowledge about how air pollution can affect their health and the actions they can take to avoid it can help patients better manage their own health, as you can see in these quotes from people we have worked with. While avoiding air pollution is an important first step for vulnerable patients, reducing air pollution in the first place is the best way to protect ourselves against air pollution. Given that traffic is often the primary source of air pollution in cities, and that 5% of all road traffic is attributed to NHS-related travel, NHS staff, patients and visitors have a great opportunity to reduce the pollution that they control. There are many actions staff, patients and visitors can take to reduce emissions from vehicles and at home that include: use your feet, take to the street. Leaving your car at home and walking or cycling will not only cut down the amount of pollution you make, but will also help increase levels of physical activity. An increase in walking and cycling levels can help reduce the risk of developing coronary heart disease, cerebrovascular disease, depression, dementia, and diabetes. Secondly, switch your engine off when stationary. By turning off your car engine whenever you're not moving, and it's safe to do so, you'll help to make the air cleaner for you, other drivers, and pedestrians. Sign up to the No Idling campaign for more information at #NoIdling. Thirdly, drive into the future. More than 80,000 people bought low-polluting cars in 2016. When you upgrade your car, explore an electric or LPG model, and you'll save on road tax too. But if you have to use petrol or diesel, ask your car dealer for the least polluting model, as they can vary enormously. Finally, make the courier do the carrying. Many city workplaces report that half of all deliveries are personal parcels for staff. That's a lot of extra vans clogging up the city. Delivery companies now have clever ways to save you carrying parcels too far, like pickup points in corner shops or lockers in train stations. Consider using click and collect services close to home. www.clickcollect.london has a handy national map of collection points. Just put in your postcode, whether you're in London or elsewhere. NHS staff talk to thousands of people every day. This is a great opportunity to let people know what they can do about air pollution. We appreciate the time pressures faced by health professionals, so if you only have minutes, here are the key actions you can take following this presentation. Firstly, incorporate air pollution advice into care pathways. Think about where in your care pathway you can give messages to patients who are most vulnerable to the impact of air pollution. We also have patient information leaflets available. Print them out for free from the National Clean Air Day Healthcare Toolkit and give them to your patients. Secondly, tell your colleagues. Share the information in this presentation with your colleagues. Talk them through the presentation, just present the key messages, or together work out the best moment in the patient care pathway to give patients advice and the leaflet about air pollution. In addition to advising patients about air pollution, health professionals have an important role in working with local partners to help drive and coordinate joint action on air pollution to benefit public health. You can work with your local authority and other local partners to promote active travel schemes, such as cycle to work schemes, workplace travel policies, and school travel plans. Talk to your colleagues to ensure that tackling air quality is linked to other public health priorities, such as obesity. Work with your Health and Wellbeing Board to make sure that actions to improve air quality and health are included in your local Joint Strategic Needs Assessment and Health and Wellbeing Strategy. And finally, lead by example and take the suggested actions to reduce and avoid pollution, both as an individual and as an organisation, and let other people know you're doing it. Work with local and social media to promote your actions and inspire others to take action too. Thank you for taking the time to understand more about air pollution and health and the actions that you and your patients can take to reduce air pollution and protect your health. For more information, visit www.cleanairday.org.uk.